The COVID public health emergency in the U.S. ends this Thursday, May the 11th. The World Health Organization ended its COVID-19 emergency declaration Friday. Most countries have already ended their states of emergency and lifted most public health restrictions as well. So what does this really mean? And what does this mean for you and your families in protecting your health? Jess Arnold joining us right now to provide a little context to all of this. So Jess, the public health emergency ends in just 3 days. What are some of the main changes that we will see?
Yeah, Larry, well, some of the biggest points are that those tests might not be free for you anymore, and thousands in our area could be at risk of losing their Medicaid coverage. The D.C. Council actually held a roundtable about the public health emergency ending last Thursday, and here's a little bit of what the interim health director had to say about its impact in the district.
We want to assure residents that we are continuing to protect their health by enhancing access to COVID-19 vaccination opportunities, as well as other important vaccinations, such as new grant funding to healthcare organizations to provide vaccine services to harder to reach populations.
Interim Director Dr. Sharon Lewis said that all of the district walk-up COVID testing and vaccination sites have closed, but they're working with Safeway and GW Health to currently offer 3 spots where you can pick up free tests and get your shots through July. Nationally, though, you may have to start relying on insurance to cover those tests, which is not guaranteed to be free for everyone. Now, I mentioned Medicaid, too. A January report from D.C. shows that close to 300,000 residents were enrolled in Medicaid in 2022, and that's up from pre-pandemic levels, at least partially because of that federal expansion of Medicaid coverage. Now, some of those folks are at risk of losing their coverage. Labs also won't be required to report COVID data, which can make cases harder to track. And remember, people are still getting sick and dying from COVID. As we told you before, wastewater testing could be key in helping to track outbreaks moving forward. Here's what the CDC's deputy director says is the reason this public health emergency is ending in the first place.
The nature of COVID-19 is different now than it was 1, 2, or 3 years ago. Because of the work of getting vaccinated, getting tests available, and getting therapies, it's not the acute emergency that it was before. That's a good thing, even though it remains a risk.
Now, the D.C. health director also said that they're launching a new surveillance dashboard in the fall for respiratory illnesses, including COVID. It won't be as robust as we saw throughout the pandemic, but they say they will continue to track its impact. And those alerts that we get on our phones when you've been in close contact with someone who had COVID, those also end on Thursday. Larry?
No doubt this is going to require a shift from everyone. I think a lot of us have become quite comfortable with the alerts and kind of the policies. Certainly a sign that we are moving in another direction. Certainly good news, but a little caution with everything, as we all know. Jess Arnold, thank you so much. We appreciate it.